And there are a ton of solutions out there. And so this process is a framework to really help take control of healthcare costs and evaluate different solutions in the marketplace. It's a simple 3-step process. First step is control. And to me, that means collecting your data and understanding what is in your data, what's driving your costs. It means setting up a 3-year at least strategy, a multi-year strategic plan to hold you as the employer and your broker accountable. And then third is evaluating funding arrangements. And, funding arrangements, different fits for different employers, but ultimately a self-funded arrangement is going to give employers the most flexibility because it really allows you to do the next 2 steps in the process, which is align your health plan with partners that have your best interests in mind. That does start with your broker, but we apply this to every partner within the health insurance plan, and asking a couple key questions. Does your solution reduce the total cost of care? How do you get paid? Are you willing to disclose that contractually? And will members actually utilize the programs that we're putting in place? So kind of a framework to evaluate partners there. And the last step is reward. Whether you're changing carriers from Blue Cross to United or Cigna, you're making a deductible change, or you're potentially asking employees to do something different. If we want them to do these things, we have to reward them when they're making good decisions that benefit everybody. And frankly, I found one of the best ways to do this is by making things free. There's so much dollars wasted in healthcare that we can still make things free for employees to really incent them to make the right decisions. So today what we're going to do, we're going to apply this to the hottest topic in healthcare, pharmacy dollars. And just to kind of level set with employers out there, I typically see the range of prescription drugs eating up about 20 to 40% of total healthcare spend. Definitely see it on the lower end as well, but I've also seen it on the higher end. And when you think about where these dollars are actually going, sure, there's maintenance medications out there. I'm thinking more so generic drugs, but this might only make up about 15% of your total spend. Could be 90% of your prescriptions, but only 15% of total spend. You got other things that are significantly driving costs, which is these specialty meds. These are the ones that you see on the TV commercials, the high cost drugs. And then obviously GLP-1s are a huge topic right now. Employers are struggling with what to do here. And the future holds, potential additional applications for this drug as well. And then finally, something that may not be on your radar right now, but probably will be in the next 5 years is gene therapy drugs. These are the ones that are costing multi-million dollars, but also have, significant upside to the member here. And so, these are where your dollars are going right now. The unfortunate part is many employers they don't have a lot of visibility into where those dollars are actually going. And there are some ways that you can get at this, and we're going to talk about that. But, I think the message I would send to the employers watching this on the phone today is if you're not actively managing your prescription drug plan, or your pharmacy benefit manager, your broker is not actively managing your pharmacy plan, you are likely missing some pretty big savings opportunities. Because almost every single time I run an analysis for a client or a prospect, I find it's fairly easy to identify. The question then becomes how do we do a better approach here?